thank you for joining us. My first question is, what do you think is the role of the 18th Amendment, and do you think it's going to affect our MDG targets and strategies to achieve MDGs?
Well, the 18th Amendment interplays with Pakistan's ability to achieve MDGs in many different ways. Because what fundamentally the 18th Amendment has done is that it has devolved health. And of course, we all support the evolution of health as a subject. But then there are national roles in health which need to be maintained at the national level. For instance, health information is a national responsibility. That's not something you can devolve to the provinces. In an environment where avian influenza and re-emerging infections are a threat. And even countries like Canada had this experience of devolving health information and had subsequently to go back on that decision. So health information is one of the responsibilities which will continue to be national. And this heavily interplays with MDGs. Because in the health sector and indeed in many other sectors, you need evidence as a basis for decision making and subsequently implementation. So that's one area. Secondly, health regulation, across different dimensions, regulation of human resource, regulation of drugs and related products, regulation of services, needs to continue to be a national responsibility, especially in a country where interprovincial trade is guaranteed by the Constitution under Article 151. You can't have different standards for different provinces when people can seek services in different provinces, when there's free movement of human resource and medicines and products. So that will continue to be a national responsibility. And then there are other areas, for instance, Pakistan's international commitments. Pakistan mobilizes a lot of resources from multilateral and bilateral sources. And many of these resource pots are directly linked to the Millennium Development Goals as indicators. So Pakistan should continue to have institutional arrangements at the national level to take responsibility of these areas. So in a nutshell, there are many national roles in health which need to be retained. This notwithstanding, the decision to completely devolve health under the rubric of the 18th Amendment is a very welcome step. But we need to be mindful, number one, of national responsibilities. Secondly, provincial capacities to take on these responsibilities and the asymmetry in provincial capacities, because not all of them are same. And I think what Pakistan needs to do is to have a consolidated plan, now subsequent to the Implementation Commission's decision. And there has to be an appropriate focal point and responsibility to incrementally cascade that plan into implementation to ensure that service delivery responsibilities are fully devolved, but that the elements of national responsibilities which influence Pakistan's ability to deliver on the MDGs and other time-bound outcome-based targets are actually retained at the national level.
All right. We're also talking about climate change and trying to establish understanding of the role of climate change and impact of climate change on health. What do you foresee in Pakistan? What impact has climate change made on health issues in Pakistan?
Well, right now you saw that the floods of 2010 displaced a whole host of population. It was an unprecedented catastrophe. It displaced people, it impacted their livelihoods, their health status suffered, and our information systems were not fully able to capture the health impact of that natural catastrophe. So as an immediate starting point, even if you stop thinking about the medium and long-term effects in terms of what climate change will do to vectors, what climate change will do to disease patterns, what it will do to migration of populations, and so on and so forth, and the raw materials, ability to manufacture drugs. There are so many medium and long-term implications that are on the radar, and which we conventionally tend to envisage as falling within the rubric of the interaction of health and climate change. That notwithstanding, we have seen such an immediate effect of climate change on people's well-being, And that, of course, is very much a health concern.
And my last question is, we're all concerned about evolution, 18th Amendment, and really we're concerned about everything that's happening in the country. What would be your advice to policymakers right now?
My advice to policymakers should be that they should, number one, agree on the national roles which need to be retained nationally. They should make sure that there is no fragmentation, that there is apex responsibility for health, that there are the right linkages between health information, evidence, policy, planning, the broader based planning, and resource mobilization, particularly at the international level. My advice to them would be that they should look at the Constitution carefully, and they should be convinced that the Constitution actually enables them to retain these national roles, and that they should resist the temptation to fragment health on the one hand. Secondly, it's important that they look at the provincial side of the equation, because the responsibilities that they have devolved to the provinces require a certain level of competencies in human resource and institutional terms, and that they should handhold and assist the provinces. They should convene the development partners. They ought to develop a consolidated plan which needs to be phased out and which needs to be implemented in a phase-wise manner.
That's a lot of advice. Yeah, but thank you so much.